All right, I'll just kind of go from here. And yeah, so I'll just introduce myself a little bit. So I'm Dr. Rose Ying. I'm a psychologist at the Menninger Clinic. Transgender healthcare is something that I'm very passionate about and I'm very interested in. So I have a lot of focus here at Menninger, which is an inpatient mental health clinic here, on sort of D&I issues, and specifically my interests lie in trans mental health. It's a topic that also is very near and dear to my heart because of a lot of the legislation that has been kind of proposed. And I want to kind of go over that a little bit just to kind of give y'all a sense of what the landscape is right now and why it's so important for us to talk about mental health for trans individuals and how we can support them. So yeah, before I get into the presentation, I certainly want to recognize that I am a cisgender woman and I am a person of color, but I'm also aware of my privilege as I even give this presentation. So I certainly want to sort of acknowledge that ahead of time. But again, just really honored and excited to be here. Yeah, so I'll go ahead and get started. Okay, hopefully this works. Hold on. Did it go to the next slide?
No, ma'am.
Okay.
There you go.
Perfect. Okay. So why this moment particularly is so important for us to talk about trans mental health. So currently we're in what we call sort of like a culture war. So there's a lot of NPR podcasts and some articles about, why has there been recently in 2021, just in the last 6-7 months alone, a slew of legislation that's basically anti-trans. There has been more bills proposed and passed in 2021 alone than the last 5 years combined, right? There's a host of political and social factors that, they kind of debate and talk about of, why states are kind of really proposing these bills and really wanting to essentially curb the rights of trans individuals. Y'all may have heard in the news, Arkansas was one of the first states to have a slew of bills that were passed. And some of those bills included, individuals, so providers can deny healthcare or deny services to an individual based on their gender identity, based on their sort of religious beliefs. And so a lot of states, including, unfortunately, Texas, has really followed suit on that. And there's been a lot of debate about whether these bills are appropriate, whether they are infringing upon the rights of individuals, and quite frankly, at this time, infringing upon the rights of youth. So a lot of these bills that have been proposed and passed have been focused on trans youth. So some of them are regarding youth and access to hormones. So some of the bills are saying medical providers, such as an endocrinologist or primary care provider, could lose their license or suffer legal consequences as a result of prescribing a youth either puberty blockers or estrogen or testosterone, right? So again, inhibiting their ability to actually help youth who identify as part of the trans community or as gender nonconforming. So very upsetting. And also one bill that was, I think, proposed in Texas, but I do not believe has been passed, is that it could actually criminalize parents who allow their child to engage in hormone therapy. So I am a parent. I actually have another little one on the way, and I just can't fathom if my child is so highly distressed, potentially depressed and suicidal because they feel that the body that they currently reside in, that, they are not allowed to change any aspect of their body. And that if I were to help them, that I could actually be charged in Texas with child abuse, right? And so, this is kind of, I think that bill was shot down. I can do a little bit more research on that. But this is, again, kind of the landscape that's been really set up for us, in which trans youth in 2021 have really been targeted. And then we have sort of the political divides, the social pressures that are also present. And then also knowing that, trans individuals are also being negatively affected by COVID-19, specifically individuals of color, because what we do know is that COVID has disproportionately impacted communities of color, right? So this is really, again, a moment that's very, I think, important given the slew of legislation in 2021 alone. And I also think that this is a time that we need to build awareness and solidarity so that we can be better advocates for the trans community and better allies for the trans community. And again, like I said, I'm a parent. So if my child grows up and wants access to hormones, I want to be able to support them in that process. And right now it's tenuous if that's is even going to be a possibility. So again, not only is it a topic that I'm interested in, but certainly it's something that's very relevant right now about how we can support the trans community. Let me see. Okay. So a little bit about the history, just very briefly. And I think I want to highlight the history about trans individuals and gender nonconforming individuals, because a lot of it involves gatekeeping. A lot of it involves stigmatization. And so I do think it's important to briefly cover it, right? So David Caldwell was a sexologist, and in 1949, so I mean, this was what, 70 years, a little bit over 70 years ago, so really not that long ago. He wrote about the phenomenon of sort of transsexuals, and he used language from the field of eugenics, and to kind of say that trans individuals had poor hereditary background and grew up in a highly unfavorable childhood environment, which made them trans, so to speak, right? So I'm really summarizing that, but they were considered at the time individuals who were transgender, gender nonconforming. At the time, they were called transsexuals, and they were deemed as different and deviant from normal human beings, right? So that's kind of sets up the stage in the United States of like individuals in the community have not been treated or seen as in a very favorable light. So Harry Benjamin in 1966, so he was also a sexologist, but also an endocrinologist as well. He actually really championed trans individuals and the rights of trans individuals. He worked closely with Christine Jorgensen, who was the first public male to female figure in the United States who had a very public media following about her transition, which included, I believe, hormones and surgery. But he really kind of advocated for saying that gender and sex are different constructs, right? And that they are not interchangeable. So much so that, his name was used on the World Professional Association for Transgender Health Standards as initially as kind of like championing their standards of care, of what is the best care to give an individual who identifies as trans and may want to transition, like sort of what does that entail and what should providers be looking for? That is positive. This was a poor hereditary background. And so, in 1966, Harry Benjamin kind of really championed this and brought this to light about, hey, sex and gender are actually different constructs. So then arose university gender clinics, which was about in the 60s as well as the 70s. So these were gender clinics to help individuals transition. So they provided hormone therapy as well as, at the time, they called it sex reassignment surgery. Now the more appropriate term is gender affirming surgery. So although this is a good thing that this was even established, because prior to this, there were no clinics that specifically helped trans individuals transition. There was a lot, this is also the rise of gatekeeping, right? To where, only white people at the time were allowed to be part of transition. So people of color were actually explicitly excluded. There were really rigorous interviews that you had interviews with family members. There was like extensive therapy. Basically, other people were trying to say like, are you trans enough, or are you the right type of trans person to where that we would be okay with you undergoing hormone therapy and then potentially sex reassignment surgery, right? So again, this is the rise of gatekeeping. They would look into individuals' backgrounds. So if you're really trans, then you would have divorced your spouse already. You would have come out to everybody. You would have done right? So they had a kind of like a list of criteria, again, back to this idea of gatekeeping that determined, oh, like, are you truly trans enough in order to transition, right? So again, from a very early time, we've really kind of dictated for individuals in that community what they could or could not do, whether they had access to hormones or not. And so this is a phenomenon that unfortunately still exists, right? So the DSM-3, trans individuals were really pathologized. It was called transsexualism. It was considered a disorder. So this is the Diagnostic and Statistical Manual of Mental Disorders, kind of like the holy grail for at least psychologists. The DSM-4 was, instead of saying transsexualism, it was gender identity disorder, which still is, for some trans individuals, they feel kind of pejorative, saying this is a disorder. Finally, in DSM-5, which is the one that we're currently on, our current version, it's called gender dysphoria, which highlights the dysphoria of an individual who is living in a body that they do not feel like fits their gender identity, right? So there's been a lot more approval, so to speak, for having gender dysphoria, and it can now be diagnosed in adults and adolescents and children. I'll talk a little bit more about doubly path when we get into resources, but I wanted to highlight the history just briefly to kind of talk about this idea of stigma, gatekeeping, and how trans individuals were historically and still are marginalized in our community. All right, so according to the APA, 0.5% of the adult population aged 18 to 64 identify as transgender in 2019 or 2009 to 2011. Although that statistic has probably drastically changed, and this number is underreported. The reason why there's not a lot of hard, solid numbers is just because it's really difficult to do some of these surveys to determine actually how many individuals are out there who identify as trans, as gender nonconforming, as gender diverse, as gender queer, as gender non-binary, right? And so, I think we need to do a lot more, sort of like an updated version of this. So I'm going to use trans and TGNC kind of interchangeably in this presentation. TGNC stands for transgender and gender nonconforming individuals. This is not to exclude anybody who identifies as gender diverse and gender queer, gender non-binary. This is just simply because I don't have enough time to say all of those words for each time I mention trans, right? But some stressors that I already sort of highlighted, which included the bills that are being proposed, as well as sort of the history in the United States of how trans people were treated, is, they're facing rejection, non-affirmation, discrimination, victimization, internalized transphobia, which is a lot of individuals in the trans community will say that's something that's very tough for them to deal with, and negative experiences related in general to their gender identity. I think with all of these factors, which I'll get into a little bit more, kind of being these unique stressors related to somebody's gender identity, this is certainly going to impact their mental health, right? So it kind of makes logical sense in my mind that it would affect them. Okay, so there was a survey that was done in, so this is 2011. I updated on my other slide after I sent it to you, Sean, but there was another study that was, I believe, done in 2016, but it's pretty comprehensive, the 2011 study, where they assessed for discrimination, and there were 6,500 respondents. This was all kind of given out online. And what the finding was that across the board, discrimination was evident for individuals in the trans community, with that being even more adverse, and the effects of that being more adverse for people of color, right? Overall, respondents were four times more likely to be living in extreme poverty. So I think the cutoff they had said was $10,000 for per household income per year. 40, this one I think is pretty huge. 41% of respondents reported attempting suicide at least once. That is almost half of the community that responded in the survey. But I mean, if we think about that, that's huge. That is significant. That to me says we need to do something different to help support the trans community. Because this is also indicating these are individuals who attempted suicide. We're not even accounting for, in that percentage, the number of individuals who've contemplated suicide, right? Who've had suicidal ideation. That number, I imagine, is significantly higher. And so, I mean, we really need to think about how staggering that percentage is. It's as if out of every other person has attempted suicide potentially, right? And how scary that is, and how you would be thinking about how can I get support for this individual, right? So I think that is it's a statistic, and it might be some underreporting, maybe a little bit of overreporting, but the fact of the matter is, that really kind of is a kind of screams sort of like a siren to me that we need to do something different in the United States to support the trans community. This was really sad. Again, as a mom, and I have another little one on the way. They were saying in the study, children and youth experienced ridiculously high rates of harassment, physical assault, and sexual violence. I believe for harassment, it was like 78% of youth reported being harassed, 35% reported being physically assaulted, and 12% reported having sexual violence perpetrated against them, right? And so again, these are numbers that are just staggering and very scary. And so we really also need to kind of think about not only how do we support trans adults, but we're thinking about how do we support individuals, youth, and children. So again, some of these bills that are passed that are restricting the rights of youth and their ability to transition is really, again, dismaying, knowing sort of these numbers, right? So double the rate of unemployment than the general population, with 90% reporting being harassed, mistreated, or discriminated at work. 53% of individuals in the trans community reported being verbally harassed or disrespected in a place of public accommodation. Again, very, very, very high, right? We're talking about that's a very significant number. Something that I think is just a personal experience that I know is not the same, but I think about sort of this being fearful in public, of being fearful of being victimized, of being fearful of being harassed in public. It's really come to a forefront for me and my family. We're immigrants from China, and with the COVID-19 pandemic and the use of words such as China virus, I've experienced some of that anxiety and that fear about just even going out in public, right? And wanting to kind of my parents to stay home and, but for this is all to say, I only got a little taste of that for what it would be like for an individual who is trans and to have to live their life for years fearing public harassment, discrimination, and violence, quite frankly. And this is also, again, a number that's kind of shocking, but also not super surprising to me. But 50% of these individuals reported needing to inform their medical provider about transgender care, right? So this is going into a clinic, going into a clinic or your physician's office, and having to let them know what it means to be trans, right? What it means to have hormones, what it means to have had gender affirming surgery. So, again, that can feel for individuals very humiliating. And, in qualitative studies, trans individuals have said that makes me not want to seek out healthcare, right? Which is concerning for us when we think about mental health care, but also healthcare, because then what can happen is whatever health condition that they're experiencing, they might let it get bad enough, quote unquote, before they present to a provider, because then it's too painful or it's too distressing, like it's too much. So that is actually really concerning, because then that could be an increase in fatalities and an increase in cost of medical care that a lot of these individuals cannot afford, right? Especially if they don't have insurance. So, we're really caught in all of this, in which as institutions, I believe, in the United States have not been fitted or retrofitted to really support individuals in the trans community or the TGNC community. And I truly believe that really needs to change as we move forward. All right, and then the next one. Okay. So this study in 2016, so they kind of did they repeated this study, although I don't believe there were as many participants in this study in 2016. But what they found was that people of color experience broader and deeper patterns of discrimination than white respondents, right? So again, like I said earlier in the presentation, we already know that communities of color have been disproportionately impacted by COVID-19, right? Black respondents specifically talked about not wanting to go to law enforcement, not trusting law enforcement, not trusting healthcare providers, which is, if we think about it, these are the very institutions that are supposed to protect us and are supposed to protect the people that we care about. And yet the idea of going to these individuals and going to these institutions and then suffering harassment or disbelief or victimization at the hands of the people that are meant to protect. I mean, this is kind of like, this is the very core of their struggle. And so, I think, again, there's actually a study that came from this where they pulled out a lot of these results. If y'all are interested, please go on, I believe it's hrc.org, and they have some really good data, really good reports about the trans community, the impact of discrimination, and specifically, there is actually a specific report about the experience of Black trans individuals and how that differs from trans individuals of white trans individuals, for example, or the general population. There is a very good PDF on that. So if you're interested, please look into it. What they found too was individuals with disabilities who identify as part of the trans community were more likely to be unemployed, more likely to have extreme levels of poverty as well, right? When we're talking about also unemployment, I'll get into this, I think, a little bit more later, but when we're talking about unemployment, what we're also talking about is how are these individuals surviving, right? So they're living in conditions in which the entire family is making less than 10 grand a year. They're unemployed. They're not able to get employment because not every state actually has protections based on gender identity, just like not every state has protections based on gender identity for housing, for example, or employment, or this or that. In Texas, unless this has changed, but I don't think it's changed. In Texas, individuals can be discriminated against based on their gender identity, specifically for housing. So if a landlord did not want to rent out a place or whatnot because the individual the individual is trans, or they I think legally can do that. Now, that might have shifted. Again, there are some really good reports out there delineating state by state and county by county, actually, of what protections are provided for individuals who identify as trans or TGNC. So if you're interested in that, please look into it and figure out what protections are in your county or protections are in your state as well. Okay, next slide. Okay, so this is a topic that is also near and dear to my heart because it really is quite an epidemic about how Black trans women are being treated by society, and specifically the hate crimes and violence against Black trans women. So if you look into sort of violence against trans individuals, what you'll see is that Black trans women have historically and still recently been targeted and have been fatally shot, drowned, in very, deaths in very horrific ways, simply because they're Black and they're trans, right? And there was actually a really famous case. There's been a lot of famous cases, but in sort of recent years, there's a really famous case in Charlotte that started sort of a lot of protests in Charlotte, North Carolina. There was a young Black trans woman who was found shot to death in her hotel simply, again, by being Black and trans. So, I think this is really, some people have described this as a pandemic within a pandemic with COVID-19. But what we're thinking about is a combination of high levels of poverty and hopelessness, lack of protection for trans people of color, but this all comes together to mean that Black trans women are especially vulnerable to being targeted. Angelica Ross, who is a Black trans woman, and she actually has her own, I think she developed her own software company. I think she's taught herself essentially it seems like software engineering. So she has her own company, and she said in an interview with, I believe, Huffington Post, being trans comes at a high cost, but being Black and trans can cost you your life, which I thought was a really poignant sort of description of kind of what's been going on, in which Black trans women are, what they're having to face is racism and transphobia, biphobia, homophobia, all kind of tied together. And the result of that is that they are being targeted and killed, essentially. And so, this is something that we really need to kind of look at. I believe last year and this year too, there have been rallies in specifically New York or Brooklyn about sort of like Black trans lives matter, right? And so, I think it had a really great outpouring of showing and support. And it seems like it might be sort of like a yearly type deal to bring awareness to the fact that Black trans women are dying for being Black and trans, right? And so, again, I'm kind of saying this, but some of this just really is, even as I present it, still shocking to me. Some of these statistics are still also shocking to me as well. And so, I think it's again, something that we need to address as a society. So mental health in the TGNC community. So there is actually a dearth of literature. And the reason being is because there's been a lot of focus on the violence, suicide, and trauma within the trans community, right? Which is, they're assessing for rates of trauma, assessing for rates of hate crimes, for example, which is, of course, important. But I think something that we do need to know is a couple of things. One is that the mental health of the TGNC community is significantly impacted by stigma and discrimination that is specific to gender identity, right? There's a minority stress model that's proposed by Meyer, and I think he proposed it in 96, but maybe he could have revised it in 2003. And he was talking about specifically LGBTQ plus individuals. But essentially what he was saying is individuals in that community are faced with 3 additional stressors, right? Along with just sort of everyday stress, finances, childcare, whatever. What he was saying is, number one, they're experiencing a hostile and stressful social environment. So this includes, like I've mentioned before, harassment at work, being denied access to certain services, being denied access to housing based on your gender identity, rejection from peers, rejection from your family, which is huge for individuals. And so again, all of this kind of creates this hostile, this stressful social environment. And then there's this added, in addition to that, the second factor that he was pointing out is vigilance to attack or perceived attack. So this makes a lot of sense, right? So individuals who are in the trans community who have experienced discrimination, harassment, violence, stigmatization are going to be more on guard when they go to a public setting, when they go to work, when they go to their social circles, when they go to a ball game, right? This is, again, privilege that I think in some ways I've really taken for granted prior to COVID. And now I have just an inkling of awareness of what it might be like for somebody to constantly be on guard. A really good example that comes to mind, a personal example of this, is I have some friends who identify as part of this community and who live in the Houston area, but they have family in like Dallas or Austin or San Antonio. And one thing they always tell me is, I make sure that I don't drink any liquids like 2 hours before I go on my drive. I make sure my gas tank is filled up. I make sure there's maintenance that's been done on the car. And I'd be like, well, this is all great for getting you there faster. But the idea for them of stopping at a gas station, a rest stop, to go use the restroom, to go get a, kolache, to go get gas is actually really terrifying, right? Because when you step out of Houston here, or when you step out of Austin, or when you step out of Dallas, the political and social landscape changes drastically. I've experienced this in some ways, but not certainly to the degree that some individuals in the community have, right? But that really kind of highlighted to me this idea of vigilance, right? In which you really have to prepare yourself to think about, how am I going to ensure the safety of myself and my loved ones, right? I'm not going to stop for gas at this place that, may not have may discriminate. I might get verbally harassed. I might get physically harassed, right? So that's, again, just a sort of a personal example, but really makes me think about how even going on a trip, a brief 2-3 hour ride, requires vigilance, and how exhausting that can be when you're living everyday life in sort of this vigilant mentality of, is somebody going to microaggress against me? Is somebody going to harass me for my gender identity? Is somebody going to assault me because of my gender identity, right? What we do know is, and then the third point would be internalized transphobia, which is what I've mentioned earlier, which is transphobia that you have towards yourself, right? Which is very ingrained. It's very culturally bound, and unfortunately is kind of perpetuated by our society and our societal norms, right? What we do know for the TGNC community is that they do experience higher rates of anxiety, depression, PTSD, suicide than the general population. These rates do fluctuate, or have fluctuated, depending on the geographical region, right? And I say this because an individual who lives in a small town in rural Texas, West Texas, they might have a lot more anxiety and depression related to even coming out to their family, to their community, and being fearful of attack if they did that, versus somebody who lives in maybe New York or Portland or the West Coast, where they feel that they have higher community support and potentially higher familial support as well, to where rates of anxiety, depression, suicidality, are not going to be as high. So again, it also depends on geographical region. So I think we need to kind of hold that in mind as we think about this as well. Okay. So wanting to kind of touch on some barriers to trans healthcare, and this is mental health care, but this is also just healthcare in general. Provider knowledge, like I said, I think there was a study that was done where they looked at 132 medical schools to assess how many of them had provided even a little bit of training about what it means to be trans, whether any courses on that, any curriculum. And 44 of them had no training whatsoever. So for their residents, for their medical students, and for the residents, no training at all, right? And so provider knowledge is a big issue. Like I said, an individual may very well put off going to get health care or even mental health care because they feel that they're going to have to educate their provider, which can feel very humiliating, right? Negative experiences. If, one thing at Menninger we think about a lot is, how are our patients greeted by the front desk staff, right? So, something that's come up before is, for example, asking the patient, hey, what pronouns do you prefer? You have your name listed here in the chart, but you're another name listed in parentheses. Which name would you like for me to use, right? That in itself can feel incredibly inclusive for an individual who's coming into treatment, right? I'm talking specifically at Menninger about mental health treatment, but we can really think about this universally for going to a doctor's office, right? It can feel very traumatizing and very frustrating for a provider or front desk staff to continuously use the wrong pronouns, right? If you're like, I go by they, them, their, and they continue calling you he, or him. That can be very frustrating to feel like you have to correct them constantly, right? So denial of services. So again, this goes to some of the bills that I mentioned, but a provider, again, being able to deny somebody service based on their own kind of like religious or moral justifications. Again, that can feel very traumatizing for somebody who's trans, right? Gatekeeping, like I mentioned, even though we don't have sort of these university gender clinics anymore, what we do have is still gatekeeping, which is individuals are historically, have to be assessed by a mental health provider to make sure that they can start hormones, to have letters written to make sure that they can have gender affirming surgery. 2 letters historically that they could have gender affirming surgery. So we really have to be, as providers and as allies, really conscious of that, right? Because it is a balance. We want to make sure that, we're assessing the person appropriately so that, this is the care that they actually need and not just like sort of feel on a whim, right? So we want to make sure that we assess for that. At the same time, I think it's a very fine line of respecting the individual's ability to recognize their own identity. And I guess making me think about, who are we to say, well, you can start hormones, but you can't, right? You can transition now, but you have to wait a little bit more, right? This gets into very murky territory. I don't think there is a great answer to this at this point, because we want to respect the rights of individuals and respect the right of youth as well, while also kind of doing our job to make sure that starting hormones or having gender affirming surgery is not going to be significantly actually more distressing and create more mental health concerns than the person is currently coming in with, right? So some of that we do have to kind of recognize it is a fine line, and that actually puts us in a position of power to kind of right away as providers, right? Like I said before, stigma, discrimination, those are huge ones. One is a limited collaboration amongst providers, right? Which is kind of the psychiatrist might be doing their own thing, but the therapist is over here and the endocrinologist is over here and the surgeon's over here. And there's not a lot of collaboration, right? Now, this, I think, is not necessarily just specific to individuals who are trans. I've seen this sort of in medical settings. But that's something that, I think we can improve on, which is how can we collaborate a little bit more to help this individual, whether it's with transition, whether it's with mental health care, whether it's with something that's not related to transition whatsoever, right? And the last is also cost, which can be very prohibitive. So cost of mental health services, especially for somebody who doesn't have insurance. So, again, we're talking about high unemployment rates. We're talking about high poverty rates. Cost can be very prohibitive, right? Not only cost of services, but cost of transportation to get those services, right? So, when we're thinking about what's been a really positive thing, I think, with COVID is that a lot of things have moved to telehealth. And so therefore, individuals who are seeking, say, mental health care or other types of care can have like a telehealth session instead of transportation. I say that, but then I think about, but then they need access to a phone that might have ability to have Wi-Fi or have access to the internet. And not everyone has that. Not everyone has a laptop, right? So then we have to think about, can this person get to the library, for example? Is there privacy there? Things like that, right? So we really have to kind of think about, on sort of on a deeper level, how cost can really be quite prohibitive for individuals to seek out care. Another thing with cost that's related to healthcare is in regard to transition, right? So surgeries, gender affirming surgeries are not cheap, and many of them are not covered by insurance, right? So sometimes insurance companies will come back and say, well, you want a double mastectomy, that's cosmetic solely. You don't have this disease, this disorder. Gender dysphoria, you have that, but that doesn't qualify for us to cover your double mastectomy. That doesn't qualify for us to cover your breast augmentation. That doesn't qualify us to cover your oophorectomy or your metoidoplasty, right? So they'll come back and say, you don't have any medical condition that requires us to cover it, so we won't cover it. And these are incredibly cost prohibitive procedures, right? So what then you have also is individuals who will go sort of to the underground. And by that, I mean non-legal ways of acquiring services, right? Which can be very lethal, which can lead to a lot of issues. So this was something I did in grad school where I was looking at some of the studies around trans healthcare. And one thing that came up is, individuals who wanted sort of silicone implants, right, in their pectoral muscles or in their breasts or in their chest, couldn't get it elsewhere because it was so expensive. So they would kind of get it on the streets. That can be very dangerous if you were to inject silicone into yourself, right? And there were a lot of fatalities associated with this and high infection rates, your body rejects. I mean, there was a lot of complications as a result of all of this. And so, what we're thinking about again is the cost is, again, so prohibitive. And even for individuals who do have medical insurance, it is not necessarily covered, right? So talk about sort of, hurdles along every kind of single way, along the way for individuals who identify as part of the TGNC community, right? Again, I take a lot of issue with this. So what we need to acknowledge is, what we need to acknowledge is the systems of repression and how this has disproportionately affected TGNC people of color, right? So we're talking about economic barriers, like I said, harassment, discrimination at work, not hiring somebody based on their gender identity, right? Social barriers, which include not being accepted by your peer group, not being accepted by your family whatsoever, right? Institutional barriers, schools, law enforcement, medical facilities, right? These are all areas that have been historically difficult and still difficult for trans individuals to navigate. Barriers for refugee and asylum seekers. So this one, there's been some information in the news that in the last over a year now, because of COVID, there has been less ability, I guess, due to COVID and due to sort of the detention policies. Asylum seekers, for example, who are in custody, are not given access to gender affirming care. Not only are they not giving access to gender affirming care, they're also placed in the same, I guess, ward as other individuals based on the sex assigned at birth. So let's say it's somebody who's male to female and the sex assigned at birth was male. They're then placed with all the male detainees at that point, right? Or refugees at that point, which again is a ripe place for sexual assault, for harassment, for physical assault. And they have historically refused to acknowledge that, you need to be in a different space than these other male detainees, right? So this has kind of come up specifically with COVID as well, because of the lack of sort of medical care or appropriate medical care and the number of individuals who have died in custody as a result of that. So again, we need to kind of think about this. Well, generational barriers, I think, is also a huge one, which is, somebody who's like my mother-in-law or my parents are going to have a harder time understanding and knowing how to ally and advocate for individuals who are in the trans community. Generational barriers are also applicable for individuals in the TGNC community, right? So somebody who is 18 and identifies as gender nonconforming may have a very different experience than somebody who is 65 who has never come out to their family and is now recently realizing that this is something that they really want to do, which is come out to their family and maybe live as the gender that they identify with, which includes social transition. So maybe they start wearing clothes that are congruent with their gender identity. Maybe they do start thinking about hormones, right? And so, but that could be a very different experience for somebody who's 65, who everybody knows as so-and-so, than somebody who is 17 or 18 who has kind of questioned their gender identity and has made it very open, has openly questioned their gender identity for years. Right. Another thing that I do want to bring up is intimate partner violence and assault. So individuals in the community experience very high rates of intimate partner violence and assault. But again, when we think about, well, why don't they report to the police, or, why don't they get help? Well, sometimes, for example, women's shelters or specific shelters that are supposed to help battered women are unwilling to help individuals who are gender diverse or trans, or have a policy that say that they won't do that, right? So then these individuals are turned away. So where are they supposed to go? Another thought is if we're thinking about, again, distrusting the very institutions that are supposed to help them based on their past history, based on, what they've seen happen with family members or with friends. They have no other route of support in which they feel like they can't actually get help from these institutions that are supposed to be there, again, to help them, right? And so again, intimate partner violence and assault rates are very high and also are underreported as a result of that. And okay, I think I have a couple more slides here. One thing I wanted to kind of just briefly talk about, I know we're running out of time a little bit, but thinking about transition, I think the first thing I want to say as providers, as allies, as advocates, is that transition looks different for everyone. Social transition, which includes coming out potentially, maybe, to family and friends, medical transition. Some individuals don't choose to go through medical transition. Some individuals choose to have hormones, but do not want any sort of surgery. Some individuals want hormones and top surgery, but they have no interest in bottom surgery. Some want to legally change their name, which in Texas and other states is a hassle in itself, right? But some individuals are just saying that, this is my dead name, but I don't need it to be on a legal document. That the name that I go by now has to be on a legal document. Educational and vocational. So this includes coming out to employers, coming out to colleagues, coming out to other peers as well, right? So again, these are all choices that individuals in the community have to make or don't have to make, right? They may choose to never legally transition or medically transition, and that's okay too, right? So we really need to be aware that each person's journey, I guess I'll just leave y'all with this, that each person's journey is going to look different, and that's okay. And that we need to be aware of that each person's journey will look different, and be able to be supportive as they think about what transition means for them. I found that that's to be the most helpful thing when working with individuals in the TGNC community, is just simply asking, what would you like to do or not do? If you're interested in this, great. If you're not, okay, great. How can I help support you in this? Okay, so I know our time's probably up. Have a little bit more here, but I won't go. Unfortunately, I think we're out of time, but here are some resources that if y'all are really interested in. WPATH is really sort of like the standard of care for individuals, and they have a publication that can be downloaded in various languages. Human Rights Campaign, like I said, has a ton of resources. GLAD as well, and they have a specific subsection for trans people of color. So I encourage y'all, if you're interested, please look into these resources, and there's so many more. A lot of PFLAG a lot of times has chapters in different cities. So Houston has one. So I would see maybe Atlanta has one as well. So really kind of, if you're interested in this and interested in being an ally and an advocate, please look into this further. And here are some references I got. Thank you so much.
Hey, Dr. Yang, we have two more. We have two questions. Do you see them, or do you want me to read them?
I don't. Maybe if I stop sharing my screen, I can see them. Do I just, oops. Okay, it's not working. How do I stop sharing?
I'll just click at the very top of your screen. It'll say view option, where it should give you a drop down that allows you to stop sharing.
Okay.
There you go.
Okay.
Do you see them in the Q&A session?
Yes, I believe so.
Okay.
Okay. Okay, so Renee said, with all this information that you shared, which is perfect for affirming trans individuals, how do we fight against information shared by individuals like Ben Shapiro and followers who quote a longitudinal study that seems to indicate trans individuals are not happier years later? I've heard about that study. There's actually an NPR, I think, podcast about this too. So I think that's a good question. I think, we can certainly use sort of like science to fight science, because there are other studies that are not as long-term that will say that they are happier, that they do feel more fulfilled. I think it's important at this point to, yes, it's important to think about studies, but it's also important to just talk to individuals who are trans. I feel like people who kind of use these studies as a way of saying, well, they don't need transition or they don't need gender affirming surgery because they're not happier, do not actually know a ton of individuals who are in the trans community, right? So I think some of this groundwork needs to be like, how do you get these individuals, family members perhaps, I know this is something I struggle with, to like actually get into a conversation with somebody who identifies as part of the community, to actually go to a pride rally, for example, right? So that's probably one of my thoughts. It's difficult to refute because I think we can get very intellectual with this, where it's like, well, this study said, and this one said, and, I think we can kind of go on, but it's going to be, in my opinion, pretty different for the person if you can actually talk with people who've had surgery, whatever that might be, and to talk to them about their experience on a human level. I say this probably too because I'm a therapist and I work with people one-on-one, but I have found that that's really the most helpful to understand, from a less lofty level, if that makes sense. Okay. So gender nonconforming and gender non-binary, that's a great question too. So it depends for the individual. I can kind of give an explanation for gender nonconforming and gender non-binary, but some individuals will say they identify as one or the other, and it might not fit that definition, if that makes sense. In my experience, for gender nonconforming individuals, they oftentimes will still identify as their sex assigned at birth. But they will dress in ways, for example, or engage in social activities, for example, that are not in the traditional gender norms. And they will say, I'm gender nonconforming. Some of them will also go between he, she, they, them, their pronouns, and it can be very fluid, right? Gender non-binary individuals, again, depending on the person, oftentimes, from my experience, will choose a pronoun that is sort of they, them, their, or Z, and will not kind of align with either he or she. That's just, again, been my experience. And I will say I don't have like a set definition for those two, just because individuals can I oftentimes identify one way or the other. And again, that's just helpful to ask, like, how do you identify as? Do I identify as gender nonconforming? Some will say, no, I actually identify as gender queer, which has been really cool to see in the past, I want to say at least decade, where there's been sort of kind of the use of the word queer has been really kind of taken back and used as a sort of a word that's not meant to stigmatize, whereas historically it has had very negative connotations, right? For I want to say probably in the 60s or 70s. So yeah, I don't know if I fully answered your question, but this essentially say that's been my experience, but it's always just kind of helpful to ask the individual. Oh, the resources. Yes, I can. Sean, maybe it might be helpful. I don't know. You could definitely send out this PowerPoint if that's helpful, because then I'll have the resources on there.
Yes, ma'am. We definitely can send that out to the presenters.
Okay.
I mean, the attendees.
Okay, because then the resources will be on there. Okay. I think that's all the questions that I got.
Yep, those are all the questions. So thank you so much for being parties. We're so excited that you decided to join us for this great information that you are giving us. And so